In this video, I'm going to show you exactly what reality looks like in dentistry once you graduate, why dental school doesn't prepare you for it, and most importantly, the survival guide that's allowed hundreds of my students to not just survive, but to dominate in their first year out of prac. Picture to you that may sound familiar. Picture this, close your eyes. It's 3 months into your first job. You're seeing 20 plus patients per day when you were just seeing 2 per day. Every treatment plan needs to be done in under 5 minutes. Patients are questioning everything you recommend. You're behind on meeting your production goals. Your boss is asking you why your case acceptance is so low, and your paychecks are starting to kind of dwindle after your daily minimum ends after 6 months. This is nothing like dental school. I'm supposed to be a doctor, but I feel like I'm working on an assembly line. Sound familiar? Well, it's because this is about 80 to 90% of all new grads. But here's what's messed up. Dental school actually sets you up for this failure, because in dental school, you're just trying to pass exams and get good grades, and you're not necessarily getting taught the new modern version of what dentistry is actually like. So let me just show you the 2 different worlds, right? In dental school, you see 3 to 5 patients per day max, 2 hours to create a treatment plan, an attending who has to check all your work, and you have to actually do the work that appeases that specific professor, because they all have different things that they are looking for. Patients who are accepting whatever you recommend because they're getting discounted care and they know that you're just a student, and focus on just clinical perfection above everything else. In the real world, you're seeing 15 to 25 patients, 5 minutes to diagnose, plan, and explain. You're responsible for everything that you do. You're the one that has to make the decisions. Patients are negotiating with you, they're questioning you, they research everything online, and your efficiency and leadership skills and understanding of the business are going to be more important than perfect margins. See, the gap between those two is where a lot of dentists end up, and they end up having a lot of disdain for the field. See, well, some of them thrive from day one. They see the same patient volume, working the same system, but somehow one is doing a lot better than the other. What's their secret? Well, they're preparing for the real world, not just the dental school world. And there's a specific blueprint that sets them up to do that. It has 3 core components. 1, reality-based skill development. Instead of perfecting clinical technique, they master efficiency systems, patient communication, business intelligence, and leadership. Component 2 is the mindset preparation. They rewire their brain from thinking as a dental student to a leader, and most importantly, a business leader. And component 3 is strategic positioning. They're putting themselves in situations based on the growth potential, not just salary, and they're able to negotiate from a position of strength. Here's what happens if you follow month 6, you're hitting production goals. In 1 year, starting to produce over 80,000 a month, which is a great benchmark. And in year 2, getting to 100,000, which really gives you room to negotiate and pretty much go wherever you want, as long as there is the right patient volume and have success. Especially sets you up if you want to take the ownership path. See, this person who's following this blueprint is light years ahead of their classmates who are just applying on jobs in Indeed, seeing which one has the highest daily minimum, going to the office, not understanding anything what's going on at the front of the office, staff that are checking in patients, checking out patients, no idea of the operations, no idea of what office they need to be in to twice as efficient with their time, no idea how to structure their schedules to, be productive and not just spend the whole day doing things that are not worth your time. They're working, making themselves available, doing a lot of same-day treatment. This is stuff that isn't difficult. You just need someone to show you the ropes and what to actually prepare for. So you can graduate and hope for the best like 80% of dentists do, or you can set yourself up now while you're still in dental school and dominate from your first day. I'm sharing this complete blueprint in my masterclass webinar, which is completely 100% free. And spoiler, I do not have anything to sell you guys. For those that want to work more closely with me one-on-one, I will speak to you about those opportunities, but really just here to show you guys the ropes because no one showed me. I wish there was someone out there. I see a lot of discouraging content out there. Dentists having disdain for the field, and it's not really encouraging to those of you guys who are in dental school. So just trying to really be a beacon of light. So please hit the link. You could also join my free school community to get more one-on-one access to me. You can message me on that, and any questions to those of you that actually join, which is also free. And yeah, don't just graduate hoping, be prepared. I am looking from afar, and I wish you guys peace.